Welcome to Learn Tech Today English YouTube channel. Today, we are diving into an explainer on a truly life-changing topic. We're going to explore how artificial intelligence is poised to absolutely revolutionize global mental health care accessibility. So if you think AI is just for, writing emails or doing your homework, well, get ready to be amazed today. We are talking about shifting the paradigm of care from extreme scarcity to unprecedented abundance. Imagine waking up at 3 a.m. with a massive panic attack. Your chest is tight, you need a therapist right now, but you realize your next appointment is 3 to 6 months away. That's terrifying, right? But what if you could simply pull out your phone and instantly talk to an empathetic, world-class therapist who knows exactly how to calm you down, and for less than the price of a Netflix subscription? Sounds like a total miracle. But let's look at the real world. That lack of access isn't just a bad dream, it's a harsh reality. 129 million. That is the number of Americans who currently live in professional shortage areas for mental health care. Because of this extreme shortage, getting help isn't just difficult, it's virtually impossible for a huge chunk of the population. It can literally take 3 to 6 months just to get your foot in the door. We are facing a massive global mental health crisis. Rates for depression, anxiety, and suicide have risen dramatically. Just to put it into perspective, in 2022, the US saw nearly 50,000 suicides. That's the highest rate per capita since 1941, along with over 100,000 drug overdoses. And the economic impact? Poor mental health is projected to cost the globe an astounding $6 trillion by 2030. Our current system is unfortunately leaving millions untreated. Now, if you are preparing for an exam, grab your pens and jot this down. Experts call our current situation the existential threat of the status quo. Basically, it's the hidden danger of keeping a broken, inaccessible healthcare system exactly the way it is, just because we're afraid of new technology. Sure, people point out the risks of AI, but they ignore the massive, guaranteed harm of doing nothing. But here comes AI to save the day. We can counter this threat by iteratively deploying AI, testing and rolling it out step by step to provide abundant, affordable, and deeply empathetic support that is literally always on tap. So let's break down exactly how AI is changing the game step by step in Section 1, Intelligence on Demand. To solve our massive shortage, innovators are turning mental health care into a highly accessible resource. Imagine paying a flat monthly fee of $19.99 to instantly access hundreds of clinical AI therapists. You could try cognitive behavioral therapy today and maybe analytical psychology tomorrow until you find your perfect match. Instead of waiting months for an expensive human appointment, this completely democratizes care, giving you world-class therapeutic expertise for the price of a streaming subscription. Now, you may be thinking of those awful, clunky customer service bots from a few years ago, but wait, there has been a massive leap. Unlike the rigid old mental health chatbots that only gave predefined, scripted answers, modern large language models, or LLMs, are a whole different ballgame. They provide natural, dynamic, and emotionally responsive connections anytime you need them, day or night, completely without judging you. Moving right along to Section 2, the 3 stages of AI care. Here is how clinical psychologists see this structured evolution playing out. Here is another important exam note for you. The 3 stages of AI care. Stage 1 is administrative assistance. Therapists spend hours writing notes, right? Well, AI can listen to sessions and draft those notes for them. Stage 2 is collaborative training, where AI analyzes transcripts to tell human therapists which techniques actually work and even helps train new psychologists. And finally, Stage 3 is fully autonomous care, where clinical AIs offer verified direct support to patients 24/7. Let's visualize this, Dostin. Section 3 dives into real-world AI therapy and some pioneering case studies. We don't have to wait decades to see this. It's happening right now. First up is the Coco Peer Support Copilot. Coco is an app that tested using a GPT-3-powered bot to help its users write significantly kinder, more supportive messages to other peers who are struggling. It didn't replace human connection. It literally enhanced human-to-human empathy and explored brilliant new solutions for our unmet care needs. Next, we have what I like to call the data detective study. In a massive collaboration, AI analyzed over 160,000 text therapy sessions, comprising roughly 20 million messages. It acted as a data detective and discovered a huge insight. Therapists who used complex reflections, meaning they actively restated and validated the patient's feelings, yielded much better outcomes than those who just gave advice. No human could manually read 20 million messages to figure that out. And grab your pens again, because here's an important definition for your exams. evidence-based practices, or EBPs. These are therapeutic approaches proven effective in rigorously designed clinical trials. By analyzing massive data sets like that Talkspace study, AI models can easily learn, scale, and replicate these exact evidence-based practices. This ensures that the care patients receive is strictly rooted in verified psychological science.
Which brings us to our final section, a superhumane future, and the idea of AI acting as a mirror for empathy.
Here is a really provocative twist. What if interacting with artificial intelligence actually makes us better humans? Studies show that AI can sometimes be more performatively empathetic than humans. A stunning 2023 JAMA study had verified human doctors and an AI answer medical questions. When panels blindly rated the answers, they rated the AI's responses as more empathetic almost 80% of the time.
Why? Because an AI never gets tired, it never loses patience, and it's available 24/7. Consistent interaction with it might actually teach humans to become more emotionally generous in our own lives. Okay, smart memory trick time. Samachaya? Just remember the word care. C stands for continuous, available 24/7, day or night. A stands for affordable, like a streaming subscription. R stands for responsive, deeply empathetic and non-judgmental. And E stands for evidence-based, trained on real psychological science. Remember care, and you understand the whole AI mental health revolution.
As we stand at the threshold of this cognitive revolution, we have to ask, will giving everyone access to a tireless, empathetic listener ultimately build a kinder society? In short, AI will revolutionize mental health by turning therapy from a rare, expensive luxury into an abundant, personalized resource available to billions. It's not about replacing human connection. It's about making sure nobody is ever left alone in their darkest hours. Remember, my dear students, your mental health is your greatest wealth. Technology is building tools to support you, but you are the true pilot of your life's journey. Embrace the future, take care of your mind, and become absolutely unstoppable. If you found this video helpful, please like, share, and subscribe to Learn Tech Today English. Don't forget to press the bell icon so you get our latest educational video notifications first. See you in the next learning video.